To Queen's Park, where we find our Faiza Amin. And Faiza, a focus on testing, days after phase 1 of Ontario's reopening, the province is struggling to meet its own testing targets.
That's right, Janella. And with the economy restarting, we heard Prime Minister Justin Trudeau say that testing is key. And we're seeing eased restrictions here in the province also. But the Premier says he won't hesitate to consider putting further measures in place if the trend in the number of new cases continues to go up as it has over the past few days. And today, Doug Ford is demanding a new testing plan he wants in place by next week. But the question is, why are the numbers not going down in Ontario?
It is too soon to speculate, to say that it's because of the opening of businesses and so on, because some of this predates the reopening. But we are looking at where the new cases are coming from.
The province, including the Premier, who says he's frustrated Ontario isn't meeting its goal of doing at least 20,000 tests per day, is watching the numbers closely. Data shows only around 10,000 tests have been processed on each of the past 4 days. And despite the earlier criteria for who can get tested for the virus, the province is now telling any person who has symptoms to go to an assessment center as it looks into increasing traffic at these facilities.
Are the public aware? Do the public know how to do it? Are some of our messaging not clear? Is some of our messaging confusing? So we have to make sure it's consistent.
The Premier is calling for a plan for expanded testing and a random testing plan by next week. He wants truckers, taxi drivers, people in food manufacturing facilities, auto workers and daycare workers to be tested, including people without symptoms.
We want to test as many people as possible, especially anyone around children. That will be in one of the categories that we're going to focus on. We can't just be testing people with symptoms. We have to start going to the broader public and start testing as many people as possible, asymptomatic people. Until we do that, we can't get our hands around the whole system. How do we know how many asymptomatic people are out there right now?
As the province is anticipating phase 2 of reopening the economy, the Minister of Health says there are a number of criteria that need to be considered. The downward trend in cases, the number of tests conducted, hospital capacity to deal with surges in daily cases, and contact tracing. Christine Elliott says they are hitting the 90% target of identifying cases within 24 hours. Premier Ford also says they've identified hotspots.
There's certain regions that really stand out. They're glowing on the map like a lit up Christmas tree. We want to surge those areas, but we need the cooperation of the people in those areas, be it go by postal code, bring in a mobile testing van, and we'll just start testing people.
The Premier today also announced funding for a number of research projects aimed at fighting COVID-19. Ford says the government will fund 15 proposals that were submitted as part of the province's Rapid Research Fund. He also adds that there are currently 22 clinical trials for COVID-19 vaccines and treatments happening across Ontario, 11 of which have been approved by Health Canada.